Medical nutritional therapy, MNT, is I'm going to manipulate the nutrition of a diseased person to treat his injury or condition. So I'm going to follow 4 steps to treat the condition. First, I'm going to assess his nutritional status to diagnose the ailment, and then I'm going to make a plan for his nutrition. He would follow it, and then after a period of time, I'm going to evaluate the success of my program. We are going to start with the cardiovascular diseases and how we will perform a medical nutritional therapy for them. What are the basics for MNT for cardiovascular diseases? Cardiovascular diseases develop due to atherosclerosis, in which there is a fat deposition into the lumen of vessels, and this starts in early age at the first decade of life and continues through life, and there is a gradual reduction of the lumen of vessels until the complete occlusion of it, leading to infarction. So in MNT of cardiovascular diseases, we are going to deal with the dietary factors affecting blood lipids. The MNT will start with the lipoprotein assessment, cholesterol, LDL, HDL, and triglycerides, and these should be done after overnight fasting. Next step of MNT is the diagnosis of the disease, and it will be diagnosed if LDL is above 130, HDL is below 3.5, total cholesterol is above 200, and total triglycerides is above 150. High HDL is protective, so we want to increase it by exercise, weight loss, moderation of alcohol. On the other hand, high LDL is risky. It is increased by high fat in diet, obesity, diabetes, and hypothyroidism. So the general goals of a treatment of hyperlipidemia will be by achieving ideal body weight, decreasing simple sugars and alcohol, decreasing total fat, especially cholesterol and saturated fatty acids, and increasing complex carbohydrates and fiber. So the first step of nutrition care process, MNT of cardiovascular disease, was the assessment, which was done by measuring the blood lipid. Next step was reaching the diagnosis after the investigations were done. Third step was by manipulation of fat and the nutrition. And the final step was reaching up the evaluation of our program that have been done for nutrition manipulation, and it will be evaluated after 6 months of a trial with the diet. So if it is not successful, then we are going to use lipid lowering drugs. Trans fatty acids are those fats that are performed after hydrogenation of the unsaturated fatty acids to make them more long-standing and not spoiled over time. It is found in abundant amount in fast food, especially those of restaurants. They have been found to contribute to obesity, high blood pressure, and even type 2 diabetes. Omega-3 is important in decreasing the risk of cardiac arrest, not by affecting the total cholesterol, but by having several effects that prevent the development of infarction, which are the anticoagulant effect, decreasing vasoconstriction, improving endothelial dysfunction, and reducing inflammation. It is recommended to follow a Mediterranean diet to decrease the risk of cardiovascular diseases because it is high in monounsaturated fatty acids, fish, nuts, and it is low in red meat. Mixed results mean that some studies showed effect of coffee on cardiovascular disease, others showed no effect. Either way, coffee drinkers have been shown to consume more saturated fat in their diet, and they are a smoker leading a sedentary lifestyle. The difference between epidemiological studies and randomized trials and results. In randomized trials, it means experiment. I give vitamin E and carotenoids and see its effects. While epidemiological study, I just observe those who are consuming vitamin E and carotenoids have an inverse relationship to cardiovascular disease. Peanuts are superior to other types of nuts as being cardioprotective, but it is better to be consumed unsalted, roasted, or raw to be of maximum effectiveness. In summary, diet for coronary heart disease should be low in saturated fatty acids, high in olive oil, to have 2 servings of fish per week, consume more fresh fruit and vegetables, try to replace white flour with whole grain flour, consume nuts, and it is better to be unsalted and raw, to add soya protein to your diet, to decrease the sodium to 2.4 grams, and to make it more flavored, you can use seasoning instead of salt. Myocardial infarction happens when there is obstruction of a coronary artery. This will lead to muscle destruction. To diagnose it, we have to perform ECG and to measure the cardiac enzymes that are the LDH, CPK, and troponin. In the first 24 hours after infarction, the patient should not consume caffeine, and his diet should be based on liquids and also to be in small amount and frequent.